Alright, we're going to begin this chapter on emergency preparedness. I'm going to be looking at your PowerPoint and your textbook. I do want to start on page 961, read the introduction. But this is just going to be telling you some of the things right here in the intro that you may have to do as the medical assistant. You will be saving a life, reducing pain, preventing further injury, reducing the risk of disability, permanent disability, increasing the chance of early recovery, and so patient education is going to be a main role, as it is in every chapter we've discussed. The more you teach patients about first aid, the better equipped that they're going to be, and the better that they can help you with. So, acute illnesses and acute injuries is what you're going to see. And acute meaning it's a rapid onset, not chronic. You may have phone calls from patients with urgent problems, and they panic and they call the physician's office instead of 911. And then, of course, you'll have disasters like the one that we discussed in class today. So you have to be prepared to be able to determine the urgency of each situation that can arise. And a medical emergency is any situation where a person becomes ill or sustains an injury requiring immediate care. Of course, you have to take prompt action to make sure that they do not have a permanent disability from their condition, or that they don't die. It can occur outside the healthcare setting as well. In fact, a lot of emergencies do. So let's see. Let's go on to preparing the office for emergencies. On page 962, you want to establish roles. There should be some kind of procedure manual regarding how your office is going to help when an emergency arises, and it should give a scenario of different emergencies. You want to post emergency phone numbers, of course, 911, fire, police, poison control, rape hotline, women's shelter, drug and alcohol center. So there's several things that you want to do as the medical assistant to have available. You also want to make sure you have a crash cart available, and we've talked about that before, but this is the cart that you can take to the exam room or to the location of emergency, and it has everything that you're going to need in it. When the EMS arrive, you want to make sure that you give them your name, I'm sorry, let's take that back. When you call EMS, you want to make sure you give them your name and your location, the nature of the emergency, the number of people that are needing help, the condition of the injured or ill patient or patients, the summary of first aid that's already been given, and then directions to your location. And you do not want to hang up until they tell you that you can hang up. Okay, so the crash cart, this is going to have your basic drugs. It's going to have supplies, alcohol pads, gauze, bandages, first aid kits, different ointments. Of course, you'll have your AED machine as well. And it has to be routinely checked, and it has to be restocked. After you use anything just one time, you have to immediately replace it. And you want to check expiration dates, because sometimes it isn't used quite often, and so things can expire, so you want to check it frequently. Some guidelines for handling emergencies. You want to check the ABCs. You want to assess the situation. You want to make sure you have the proper protective equipment, and you want to assess the patient. So ABCs is airway, breathing, circulation. When we're talking about reviving a patient that may be unconscious, not breathing, not have a heart rate. So some steps, there's 6 initial steps that you want to take when an emergency happens, and this is going to be like your initial assessment. The first thing is you want to overlook and have a general impression. You know, are they breathing? Are they unconscious? Are they having a seizure? Does it physically look like something is broke, or they're injured? So you want to generally do a quick assessment by looking at them. Then you want to determine their level of responsiveness. Then you want to assess the ABCs. Like I said, airway, breathing, circulation. Then you want to figure out the urgency of the condition. Then you want to do a focused exam. So if you see that they may not be breathing, then you want to try to figure out why they're not breathing. So you do a more focused exam, and then you want to document and make sure you document everything. Telephone emergencies. You're going to have to triage telephone emergencies quite often. A lot of people will call that are having acute chest pain, and that is considered an emergency. But you want to follow your office's protocols, and they're all different. The general guidelines for telephone triage is to remain calm, try to calm the patient or the other person that's calling, and have some confidence in yourself, because if you don't have confidence in yourself, the patient or the family member or any kind of person that's calling is gonna not feel as comfortable with you. Personal protection, of course, you want to make sure you use a mask if you're going to be doing breath to a person, rescue breaths. Make sure you have gloves, gown, goggles, whatever you need. So follow your standard precautions and keep, your PPE with you at all times, home and work. So when you document, you want to make sure that you document what you assess, what you, how the treatment that was given, how the patient responded, if the patient was transported, if they were transported, where they were transported to, the date and time in your signature and credentials. So pretty much anything that's happened. So accidental injuries, we're going to get into these. On page 964, these can be bites and stings, burns, choking, ear trauma, eye traumas, falls and fractures, and head injuries. Then you can have hemorrhaging, multiple injuries, poisoning, weather-related injuries, and wounds. And the list goes really on and on. First, we're going to look at bites and stings, and these include a variety of things. You have animal bites. You can have a human bite, a snake bite, insect bite, spider bite. So we're going to get into this on the bottom of page 964 and start with animal bites. Animal bites are going to be a bruise, a puncture mark, or a tear. And so what you want to do with these is you want to cleanse the wound, apply ointment, and a dry, sterile dressing. For snake bites, if it's poisonous, it's going to be a little different. Poisonous snakes will require anti-venom, which you usually will not have in a physician's office. But you want to immobilize and position the affected area below the heart. For insect stings, you want to remove the stinger if present, but you want to remove it like with a credit card, a flat object. Don't get tweezers, because that can rupture the venom pouch and cause further reaction. Then you want to wash the area and apply ice. Spider bites, you want to ask the physician really, but wash the area, apply ice, and keep the area below the level of the heart. Going on to burns, we have different types of burns. You have thermal, chemical, and electrical. With thermal burns, these are like hot liquids and steam, open flames. It can even be blankets and like a wet cloth that can burn. Your chemical burns are going to be obviously from chemicals, and with chemical burns you want to wash the area with cool water for 15 minutes minimum, and then you want to cover it with a dry, sterile dressing. Make sure that these burns are sterile dressing only, not a non-sterile dressing. And then electrical is going to be you're going to have an entry and an exit site with electrical burns, so you'll have two spots a minimum of 2 spots with electrical burns that you have to treat. And you're going to have tissue damage from the entrance way all the way through to the exit. So those are your 3 types of burns. You have to classify the burns by how severe they are and how deep they are. And of course we have minor, moderate, and major. So we want to look at the depth in the area that was burned. We want to figure out what the source of the burn was. We want to look at the age of the patient, the actual body area that's burned, and if the patient has any other illnesses or injuries. And of course we have 1st degree, 2nd degree, and 3rd degree burns. Okay. These are assessed by the rule of nines. First degree is going to be your sunburn, and these are considered superficial burns. So you can put like a nice and cool wet dressing over the superficial burns. For second degree burns, these are called partial thickness burns, and they can cause like water blisters to appear on the skin. So you want to make sure that you rinse it off with cold water until the pain subsides, okay, and then you want to gently pat the area dry. Make sure you don't break the blisters because that can cause worse damage. And then for third degree burn, which is full thickness burns, what you want to do, this is a real medical emergency, and so the patient needs to be kept warm, and they really need just a sterile cloth over all of their burns. And you want to elevate them above the heart. You want to make sure that you check the patient for smoke inhalation and things of that nature. Okay, going on to choking. Obviously, this is when a foreign object or a piece of food blocks the airway. So the universal sign is obviously I'm choking like this. And so you need to know your first aid with that, and you should still know this from taking Intro to Healthcare. So we're not going to go into that too much. We are going to go on to ear trauma on page 969. These can be lacerations, they can be cuts, a ruptured eardrum. So basically what you want to do is you want to wrap the ear and transport the patient. If the ear or part of the ear has come off, you want to put the piece on ice and transport it with the patient. With eye trauma, we can have a blow to the eye or a fall, a puncture, a foreign object in the eye. So, it really depends on what it is, depending on, what you would need to do. For falls, you want to make sure before the patient moves that you examine the patient. If they have any kind of back or neck pain, then they probably do not need to move. You do want to stabilize the neck if there is any kind of injury, just to make sure. And then if they have minor falls, you want to make sure you notify the physician and, of course, document everything. For fractures and dislocations, and we're looking at page 972, a fracture is obviously a break in the bone, and a dislocation is when a joint kind of pops out of place. The bone pops out of place from the joint. A sprain is a partial tearing of ligaments, and then we have a strain, which is a muscle injury that occurs from overexertion. So the treatment for these is going to be to immobilize it, to put ice on it, and then monitor the patient for this. Going on, look at page 973 at the different fractures. The complete fracture is a clean break all the way through. The incomplete fracture is when it's not broken all the way through. The closed fracture is when it's broken all the way through, but it's not coming through the skin. Anyway, then we go on to concussions, which is a jarring injury of the brain. This can happen if the patient loses consciousness. They may have a temporary loss of vision, pallor or paleness, listlessness, memory loss, vomiting. These are all signs of concussion. Severe head injuries, we're going to have contusions, fractures, bleeding in the inside of the cranium. So this is going to require immediate attention. You can have a scalp hematoma and laceration, and this is when blood gets under the skin in between the skull and the scalp. So you want to control the swelling with ice, and you want to control bleeding with direct pressure. Don't be too frightened because the scalp does bleed, and anything on the face does bleed a lot more than any other part of the body. Hemorrhaging, this is obviously heavy and uncontrolled bleeding. If somebody's having internal hemorrhaging, you want to make sure that we keep the patient warm, keep the patient quiet, keep them still and calm, and get medical help. External hemorrhaging, you want to use direct pressure, apply dressings if you need to, and then elevate the body part. And you want to put pressure on the nearest pressure point to reduce the hemorrhaging. Multiple injuries is when somebody's going to have an automobile accident or fall or something like that. So what we want to do when somebody presents with multiple injuries is assess their ABCs, perform CPR if needed, and you want to treat the most life-threatening injuries first. And then, of course, you're going to notify the physician and the EMS. For poisoning, these are usually on accident. However, they can be on purpose too. But these usually happen to children under 5, so we want to make sure we know the poison control number, and you want to give parents patient education on prevention. You know, keeping cabinets locked when they learn how to walk and crawl. That's a big one. Making sure that they keep all those things out of reach that could possibly hurt a child. If somebody does ingest poisons, you do not want to induce vomiting unless poison control tells you to do so. At that point, you can administer Ipecac syrup. You want to position patient on their left side, because if they vomit, it needs to come out. It does not need to be aspirated. And then you want to send the container that had the poison in it with the patient, if they have it. For absorbed poisons, you want to remove the clothing, wash the skin, you want to cleanse it with alcohol, and then you want to rinse it again. If the patient inhales the poison, you want to make sure they get to fresh air, they loosen their clothing, and then you want to check their ABCs. Weather-related injuries. Let's go on to bottom of page 977. We have hypothermia. This is doesn't happen too much here because it's, you know, we live in a warmer climate, but this is when the body temperature goes below 95 degrees. And when this happens, we want to make sure the patient is inside, that they're covered with blankets, and we want to give warm liquids. When they have frostbite, this is when ice crystals form in the tissues in the body. And so we want to make sure we warm the patient with clothing or some other body part, you know, give them body heat, but you don't want to rapidly heat them up. A heat stroke and sunburn, obviously these are two very common things that happen here. Heat stroke is any kind of prolonged exposure to high temperatures and high humidity. So obviously the first thing we want to do to prevent this is drink plenty of water. Then we want to move the patient to a cool place and try to cool the patient with water. Have them, you know, soak some washcloths in water, place it over their skin to help them. Sunburn, we want to soak in cool water and cold compresses. With open wounds, these are going to be your incisions and lacerations. With incisions and lacerations, the main thing you want to do is control bleeding, clean and dress the wound as your policy and procedure states. With an abrasion, this is like a scrape. It could be like road rash from a motorcycle accident or bicycle accident. So you want to wash the wound with soap and water, remove any kind of debris that's on the wound, and then put a dressing on if the physician says to. Amputations, you want to elevate the extremity, and the same thing when we're talking about if you lost a part of the ear. When you lose a part of an extremity, you want to make sure that you transport the extremity with them, preferably on ice. And then punctures, you know, if we step on a nail or something else, we want to clean the area and dress the area, and then the patient needs a tetanus shot. Don't attempt to remove anything until a doctor tells you. With closed wounds like contusions, these are bruises. The only thing we can do for that is, you know, cold compress, and then make sure that the color changes are normal with contusions. Okay, common illnesses. Let's talk about abdominal pain. This is a very common thing that can happen. Abdominal pain, there's a lot of different things that can be going on. Any kind of ruptured organ, all kind of different things. With asthma, of course, this is when the patient's going to have difficulty breathing, dehydration, lack of water in the system, diarrhea, which can result in dehydration as well. Then we have fainting, which is also called syncope or loss of consciousness, nosebleeds that are, we call those epistaxis, fever, tachycardia when the heart rate's above 100, hyperventilation when the breathing is too rapid and too deep, and then vomiting, which can also result in dehydration. So we're going to look at all of these really fast. We're going to look at we're going to look at abdominal pain. For this, you want to make sure the patient, they can lie on their back with their knees flexed unless there's some kind of swelling, but that usually will help the patient relax. Don't give them anything by mouth, and try to keep them calm, maybe darken the room for comfort. With asthma, you want to make sure that you get oxygen. Ask the physician how much oxygen that he or she wants to give. Use their rescue inhaler if they have it. With dehydration, of course, we already talked about that. You want to move the victim into the shade, give them some water, and you want to probably start an IV. With diarrhea, you want to help the patient lie on their back, elevate the legs, and probably give them something to drink, or start an IV if they're dehydrated. For fainting, you want to make sure that they lower their head between their legs if they feel like they're going to faint. Okay? If they do faint and they haven't done that yet, then you want to make sure that you elevate their head and get them a cool cloth to put over their head or behind their neck. Fever, when a fever goes about 104 or above, it's considered dangerously high. So you, again, dark place, have them lay down, give them a cool cloth to keep the fever down, and then you can administer medication if the doctor tells you to do so. Hyperventilation. This is the main thing you want to do is try to have the patient breathe through the nose and out through the mouth to have them start breathing normally. With nosebleeds, you want to have the patient tilt the head down, put tissue over the nose, and add pressure to the bottom of the nose. Or you can also do the bridge of the nose as well to stop the bleeding. Tachycardia, you want to help them to lie down and just to be calm, and that's going to lower the heart rate. Vomiting, have them lay still, give a cold cloth. We're going to have to stop right here for a sec. Okay, going on. Sorry about the interruption. Less common illnesses, anaphylaxis, like anaphylactic shock. This is when they're going to have a severe allergic reaction, so you're going to need to do CPR, check their ABCs. Bacterial meningitis can happen. Usually they'll come in complaining of a severe headache. They may say that they, are not seeing things clearly or seeing like a halo around things. That's an indication that they may have bacterial meningitis, and that's very contagious. Then we have diabetic emergencies. You have insulin shock, which is blood sugar that's gone too low, hypoglycemia. And then you have diabetic coma when it's gone too high and you have hyperglycemia. Gallbladder attack, the patient may come in complaining of severe back pain or severe abdominal pain. Hematemesis, when the patient is vomiting blood, that's what that means. Heart attack, the patient is going to have chest pain, that's the cardinal symptom. They may go into cardiac arrest, they may complain of left arm pain, tightening in the jaws, things like that. For obstetric emergencies, you have to go by what your physician's office says. Respiratory arrest, you again check the ABCs and follow CPR. Seizures, the patient's safety is a priority. You don't want to interfere with the seizure. You want to make sure you get everything that's harmful out of their way and let them finish seizing. Shock. This is, you can have hypovolemic shock from losing too much blood, septic shock from infection, etc., etc. Stroke, the main symptom here is going to be like a drooping in the face. Toxic shock syndrome. This is a bacterial infection that originates in the uterus, so you may see this in obstetrics frequently, in gynecology. Viral encephalitis, inflammation of the brain due to a virus. So these are going to be just some of your less common illnesses that you may see. Alright, we're not going to go over CPR because you should know that from taking Intro to Healthcare. So we're going to skip over CPR. And we're going to go to psychosocial emergencies, and this would be like alcohol abuse, drug abuse, spousal abuse, child abuse, elder abuse, any type of abuse. The first thing you want to do is you want to report it, okay? And then you want to provide information for community resources. If they've overdosed on drugs, you do need to call 911 because that is a medical emergency. If any kind of violent behavior happens, you want to follow whatever your office tells you to do and document. Somebody comes in and says that they're suicidal. You want to let the patient talk, let them verbalize, report your suspicions to the physician, and always take the patient seriously. Even if they've told you every time they've come in that they want to kill themselves, always take it seriously. With rape, you want to provide extreme privacy, contact authorities in the local rape hotline, and then you want to follow the protocol for chain of custody of specimens. So you have to be extremely careful when it comes to rape scenarios. Patient under stress. This happens very frequently. And we're on page 994. To detect stress from patients, if you notice that their behavior is unusual or different, that's a big indication. They're unable to focus or they can't follow directions. What you want to do is keep the patient very calm, and talk them through the stress of whatever it is. And what I'm referring to now is stress dealing with an emergency. If the emergency is with a child, the parent may be freaking out on you, and so you have to figure out on your own how you can help that parent deal with that kind of stress. So educating the patient, you need to know how to prevent and handle medical emergencies. So you want to encourage the patient and families to learn first aid and CPR. You want to provide a first aid checklist. You want to teach them how to access the EMS and how to keep emergency numbers by their phone, how to childproof their homes, and then provide them handouts that'll be beneficial for them. Okay, natural disasters on page 994. These are going to be tornadoes, hurricanes, flooding, fire, things of that nature. So triage, when we have to triage, we do three categories: emergent, urgent, or non-urgent. Emergent is when you need immediate care. Urgent is when you need care within several hours. And non-urgent is when, the patient is already dead, or when they need care but it's not critical. So those are the three ways that you're going to triage when you have a very large disaster. You should have evacuation plans in each office, shelter-in-place plans. You want to communicate during and after the emergency. Training, always train. Know what your role is as an employee, and you need to have some kind of alerting system in place. Okay, office fires. If there is a fire, you want to activate the alarm system, grab the fire extinguisher, turn off any oxygen because that, of course, will make an explosion. Close the windows, close the doors, and evacuate the building. If you have a bioterrorist attack, you want to be alert for any increased incident of disease. That could be an indication of bioterrorism. You want to take isolation precautions, use standard precautions, and inform your health department. With a chemical emergency, again, PPE, identify the chemical, report it to the authorities, assist with decontamination when you're told to decontaminate. You want to monitor the patient, document the patient care, and arrange for transport if needed. Mass casualties. This really just, it's just gonna, everybody kind of does their own thing with this, really. But you want to assess safety measures. Don't do anything if it's unsafe. Report to a command post to know what you're supposed to do. Triage the victims. Provide first aid, and then document the care, because you don't want to give somebody a medicine and not document it, and somebody else comes over there and gives them a medicine too. Bioterrorism, if it's any kind of weapon, you want to make sure that you contact the correct authority, contact public health. And physician's office is going to be the front line of bioterrorism, okay? This is when, like I just said, you're going to notice common trends and conditions that the patients may have, unusual patterns. So again, you want to notify the health department and follow their guidelines. And that is it for this chapter.